1, 2, 3. Hello, mate. Do you understand Irish?
Animals from all over the world
Bonjour.
come to see one extraordinary man who's known as the Bionic Vet,
High five. Yes!
Professor Noel Fitzpatrick.
We only get one shot at this. Here we go.
Noel and his team offer some of the most advanced treatments available anywhere.
The perfect marriage of mechanics and biology. This is what we have now, a brand new knee.
Oh, wow!
For some, it's a last chance.
It is a life or death situation because we cannot leave him like he is.
I just want you to do anything you can for him, really. Sorry.
As Noel continues to devise new ways of healing,
You're going to be bionic. Thank you so much.
he transforms the lives of his patients
Oh, that is just unbelievable.
He's raring to go.
against all the odds.
Boom! One small step for a dog, one giant leap for mankind. Well done.
Every week, the staff at Fitzpatrick Referrals welcome hundreds of patients through the doors.
Hello. Take a seat, guys. Thank you. Oh, hello, darling.
Many will only require Noel's help once, but some become repeat visitors.
Some patients are unlucky and they might have multiple problems, and seeing them back again and again, you really do get to know them and their family.
You see them come in for their rechecks and you kind of develop like this love for them.
The amazing thing is they always come in wagging their tails. They're always happy, even though they might be in a lot of pain.
Here to see Noel today are June and her 8-year-old Clumber Spaniel, Scrumpy.
Oops, careful. Sit down. That's it. Lie down. That's it. Roll over. Good boy. Roll over.
I've brought Scrumpy in today to have a scan, an MRI scan on his back. Unfortunately, he appeared to be very lame. He was like a drunk man. He was wobbling at the back.
Scrumpy and June are no strangers to Fitzpatrick's, as this isn't the first time he's had mobility issues.
He's had 6 operations before, and if anyone can fix him, Noel can.
Scrumpy lives in Hampshire with June and brother Jack.
His first operation was elbow dysplasia. Within months, he broke his first leg, and then about 9 months later, he broke his second leg.
Come on, yeah.
Then we had the hip done, and then 18 months later, we had his knee done.
Despite Scrumpy's history of ill health, he spends time working as a therapy dog, visiting the elderly in care homes.
Sometimes it's just something different for the resident in the home. It's a dog coming in to see them.
Have a treat. Oh, that's a lovely treat, that is, isn't it? I fancy that, must it?
Sometimes they don't have visitors, maybe their own family doesn't live close by, and a dog's sometimes the only visitor they get.
But Scrumpy's problems have got so bad recently that he's unable to perform his duties.
They know he's off his feet at the moment, but they fully hope that he'll be back soon. He's my friend, a companion. At the moment, I can't think of him not being here. So, we shall see what Noel can do.
Noel has sent Scrumpy for a CT and MRI scan to work out what's causing the problem in his back legs.
So you can see here where the disc at the very base of the spine, between the lumbar spine and the sacrum, is completely collapsed. That's pretty much as bad as it gets. So Scrumpy's in a bad situation, and he has multiple joints affected by arthritis, and he has major spinal issues. And I guess the question is, the universal question of love for an animal. When is it time to say goodbye? Okay, Scrumpy's mum.
Oh.
Hi, June. He is ready to go now, and I just wanted to fill you in on the details. I mean, I'm struggling with it from an ethical point of view as well as you are. He's already been through 1 hip replacement, 1 knee surgery, and 2 elbow surgeries.
Yes.
He's got severe elbow arthritis on both sides, which we are going to somehow have to treat. Plus, every disc in his spine is dried out. Plus, the disc in his lower back, has effectively exploded. I mean, you can only take it step by step, and I guess the decision we have to make at the moment is, do we take the next step? And at the moment, that step is either leave him in pretty severe pain, or just try drugs which are not working, or do major surgery.
Yes.
Okay.
We'll give him a chance.
Okay. So I've looked at the logistics of potentially doing the disc surgery on his lower back at the same time as doing a stem cell harvest for his elbows. That's a big deal.
Yes. I understand. Yes.
In the best case scenario, there's a chance that he won't be able to wag his tail for a period of time. In the worst case scenario, the nerves that go to his urinary bladder or his back legs could be permanently damaged.
So much that I don't want to give up now.
Yeah, I know, but you do. I'm deadly serious. You have to understand there's a line in the sand.
Yes, I know.
And I can't be doing it for you, you know that.
Oh, yes, I know.
If it comes to the point that he is suffering, we would have to let him go at that point, which you know.
I agree.
Okay?
Yes.
I'll get him for you. I'm
Thank
sorry.
you.
I know it's
I
a
know.
tough one. Yeah. Come on, mate.
Scrumpy will go home with June tonight, but will be back next week for his 7th operation.
Hello, my boy. Hello. Hello, my boy.
All right. Take care.
Thank you very much.
All right,
Thanks
God
again.
bless.
See you
Take
next
care.
week.
See you soon. You can't judge a person until you're in their shoes. That's the bottom line. That's like the nicest woman in the world. How many surgeries is too many surgeries? 7, 8. We wouldn't think twice about it if a human needed it. And I think when an animal is a part of a family, then we need to have a little more compassion and understanding.
If we can help him and make his life a bit easier, then we'll go for it. And this is probably the last chance. I can only put him through so much. This will probably be the last time.
It's early evening, and an emergency case has just arrived in reception. 15-month-old Dachshund Ralph is in pain and having difficulty moving. He's been brought in with his sister Lauren by Denise and Wilson after being referred to Fitzpatrick's by their local vet.
He's not right, and his yelping has been not good. Oh no 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 no! Oh, that's what he's doing when he moves sometimes. So we don't know what quite is wrong.
Now, Ralph. Where is Ralph? Oh.
Here.
Hello. Sorry about the delay. I've been busy operating. Hello, mate. How are you? So which one is the injured
This
one?
is the injured one.
I see. Come on in. Thanks very much. No, so Wilson and Denise, D-E-N-I-S-E?
That's correct.
Okay,
yeah.
please take a seat. All right, tell me what happened.
Well, we're not absolutely sure. There's a commotion outside.
Right.
He and she are running after, I think, a squirrel.
Yeah.
Disappear behind a bush. And there's this almighty yelping going on.
And she is?
Lauren.
The sister?
Yeah.
All right, I see.
Yeah, yeah. But they were very subdued
Hang
after.
on. Ralph and Lauren?
Yeah, I get it.
Boom. Okay, yeah. Right, I'm with the program. Okay, Ralph Lauren.
He doesn't like standing an awful lot.
Well, that's what I was just going to ask you. Is he able to stand?
He's able to, but he's very hunched.
Okay.
Oh,
mate, that's not good.
I mean.
Let me take that.
Thank you.
Yep.
Good boy. Good boy.
I mean, he's roached like a banana, isn't he?
Yeah.
Mm. Yeah. Okay, buddy. Yeah. Yeah. Sorry about that, mate.
No.
All right, he can go back in your arms. Hold him tight. So we got to MRI him now.
Okay.
But I won't know the prognosis just yet until I see what that looks like.
Yeah.
Ralph's condition is puzzling because it doesn't fit the normal pattern for spinal disc problems, which are common in Dachshunds. Noel wants to seek the expertise of his neurology team.
So I can't determine where the pain is coming from, Ricardo, and can you have a look at the cranial nerves for me, please?
Ricardo is a neurologist at the practice.
All right, big guy. All right, big fella. Light reflex? Okay.
Presence, yeah.
Yeah, okay. Well, we get a scan.
Ralph is sent for an MRI scan of his spine and brain.
He's only one.
I know.
The MRI scan has revealed something unexpected. There's swelling in Ralph's brain.
So we're going to take a sample of fluid from just behind the brain, and the constituents of that fluid may give us some hints of what's going on here. Okay, so there's a little hole here behind the skull where we put in the needle, and the fluid pops out, and we just catch it. Okay, done.
It will be a few days before the test results from the brain and spinal fluid, plus blood and urine samples, are back.
Okay, so, turns out there is in fact no disc issues, so we then scan the brain. And in the brain we saw this diffuse whiteness, so that is not normal. That is swelling, fluid, it's markedly abnormal. And that's where Ricardo comes in, because this is not my field of expertise, but it is his field of expertise.
So when we have this image where you see all these whiteness and this inflammation in the brain, there are three main things that pop into consideration, really. One, inflammatory or immune-mediated diseases. Possible tumor would be very unusual in such a young dog. Okay, and just because we had a couple of pictures, okay, that they can fit, for example, with an hemorrhagic stroke, I think probably the best way to go is to treat for some of the complications that we certainly have in the MRI, like the inflammation, and see how things go on.
So what we're going to have to do is give a potent steroid to try and decrease the inflammation, the swelling, and we're going to give an antibacterial therapy as well. But at the moment, we simply don't know. Nobody knows.
Ralph will remain at Fitzpatrick's while Noel and his neurology colleagues try to work out the cause of his mystery brain condition.
The main thing is not in pain at the moment.
So he's not going to be hurting.
Yeah, but we had hoped that it was just a disc.
Yeah.
So it's a bit worrying that it's something in his brain.
Only when Noel and the team discover the cause will they have a chance to treat Ralph successfully. Ralph the Dachshund was admitted yesterday with a mystery brain condition, but overnight there has been a dramatic turn of events. He's been having seizures.
Hello?
Oh, hi Denise, good morning. He's very sedated, but he had another seizure event at 7 a.m.
Oh, no.
Whatever the process is that is occurring in the brain is causing the seizures.
At least we feel he's in the best place, so that's the only comfort we're getting at the moment.
Yeah, it's a tough one. It's a real tough one. I mean, it's not a typical scenario at all. But all we can do is do our very best, which is exactly what we will do.
Okay, thank you. Thank you, Noel.
Okay, bye.
With Ralph's situation deteriorating, time is running out to get to the bottom of his mysterious condition.
We see loads of dogs that come through Fitzpatrick's, and they're the usual, like Labradors or Dachshunds or French Bulldogs.
I'd quite like to see an Afghan hound with the long, flowing, sort of perfectly groomed hair.
When an English Bulldog comes in, I'm in paradise.
We don't see very many chow chows, but they're always quite fun when they come in.
Oh, talking of chows, there's another one. Oh, easy, darling. It's like buses. You never see one and get two at once.
Randomly, you'll get this really kind of foreign breed or one that's just not quite well known. And as soon as that comes through, you're like, oh, that's new, that's different, that's nice.
Morning. Who have we got there? Hello, Buster. Take a seat for us. Thank you very much.
In reception, a 7-year-old Briard called Buster is waiting to be seen with Lara and Ian. They are also no strangers to the practice.
We were here when Buster was a pup 7 years ago, and Noel did a pioneering operation on him in his hog. I believe he was the second dog only to have had this operation.
Since the operation, Buster has led a pain-free life. Until recently.
In August of last year, he was lame in his back left leg, so it's the same leg. So I thought we better get it checked out.
I guess the worst case scenario is that Noel says the operation hasn't lasted and it needs to be redone.
That would be the worst case.
Buster is a French Briard, he's a sheepdog. I didn't want a small dog because she grew up with poodles. And
nothing wrong with poodles.
The compromise was Buster's wool so doesn't molt, but he's huge. The kids have grown up with Buster. One of them is now at university, the other is at college doing A-levels. Yeah, I mean, he has been an absolutely integral part of the family. He's been fantastic. I mean, you couldn't have a more loyal dog, actually.
Hi, how are you?
Hello.
Long time no see. How are you doing? You haven't changed a bit, unlike me.
Oh.
Nice to see you. Hey, mate. How are you? Oh, good boy. He's like me. He's got the sprinkling of black and grey now.
Well, he has indeed.
That's 7 years. My goodness. So you're concerned about lameness, are you?
Yeah.
Was he okay for 6 years?
Yeah.
Yeah.
And what happened then?
Then he just started limping and not wanting to bear any weight on his back left leg.
I mean, we were wondering whether that maybe it was a bit of arthritis.
Yeah, well, it's entirely possible that the osteoarthritis, which was kicked off by the original disease process, is getting worse.
Okay.
Entirely possible. Let's have a look. All right on the other legs?
Yes. Yeah.
It's actually not got that much swelling around it. Interesting. Range of motion is actually quite impressive. Hold tight. You seem to be more painful higher up in the limb. Push.
Okay, yeah.
That's it. Doesn't like that, does he?
No, he doesn't.
This is his sciatic nerve. Hold tight. He definitely doesn't like that. You can let him go. All right.
It's all right. It's all right.
All right, mate.
all right.
Hey, mate, it's fine. I think he's got a different problem.
Okay.
Okay.
Which is good and bad news. It's good news for me because the surgery that I did several years ago seems to still be working.
Yeah.
It's bad news for him because it looks like he's got lower back pain. This breed and several other large breed dogs can get a condition called degenerative lumbosacral stenosis.
Yeah.
You've had it yourself, sir?
I have, and I had an X-ray, and mine is the same. I mean,
It's very, very common.
The one thing that's changed my life actually is turmeric.
Oh, I see. So you're using a natural anti-inflammatory?
Yeah, it has changed my life.
Ultimately, there's 3 outcomes from this. One is you just give medical management, either pharmaceuticals or natural. One of the things that can be done is injections of steroid into the back. Yeah. The second port of call is physiotherapeutic intervention. Yeah. Surgery is always an option, and we do it when we can't get any result from medical management and you've got pain all the time.
Yeah.
Because you want to try and avoid picking up a scalpel blade if you can.
Yeah.
My recommendation to you is you need to get a scan.
Yeah. Let's do that. Let's find out what's going on.
All right, catch you later.
Thank you very much.
Lovely to see you guys.
Thanks.
God bless.
Thank you.
Noel's diagnosis was not what Ian and Lara were expecting.
I was hoping that it was just arthritis or something. Having been through the process 6.5 years ago, we know just how tough the recovery process is on both the dog and us as a family. I mean...
But it was reassuring to know that there were other options and that surgery wasn't the immediate first port of call.
We just have to wait till this evening when we come back to hear the verdict.
The family will go home and wait in the hope that they will not need to resort to surgery. This afternoon, a familiar face is back at Fitzpatrick's.
Good boy.
8-year-old therapy dog Scrumpy.
Scrumpy's booked in today, hopefully for surgery, and this is really one of the last chances we've got to get him back on his feet again. I think my nerves are worse than his. He's such a friendly dog. He's a good companion, not only to me, but everybody else. And I just want what's best for him.
June has made the difficult decision to admit Scrumpy for his 7th operation at Fitzpatrick's.
Hello, I've got Scrumpy. Yes, that's right, thanks.
Today he will undergo major spinal surgery to correct a collapsed disc in his back.
So our friend Scrumpy's in again.
Want to sit here?
It's a big old surgery. We're going to minimise risk as much as we can, and even then there's still risk. All right, Scrumpy then, please. Hi, here we go again. Once more into the fray.
Come on, that's a good boy.
All right, sweetheart. Let me have a look at your Scrumpy.
Scrumpy.
Yeah, still wobbly, mate. Let's get you out of pain if we can.
Yes.
Good boy.
Okay, boy.
Are you ready?
Yes, yes, as ready as I'll ever be.
Right.
Okay, thank you.
I'll ring you tonight.
Thank you very much. Okay.
Stay brave.
I'll be ready.
See you later.
Thank you. Thanks a lot. It doesn't get any easier, but this is his 7th operation. Scrumpy, I think, is better used to it than I am. You know, he's strong in willpower and he's stubborn, so he'll get through this. It's me. Just wait for the phone call now. I'm sure he'll be fine.
Out in the prep area, Buster, the 7-year-old Briard's hind leg lameness, has been investigated. He had ankle surgery when he was a puppy, and the family are concerned about putting him through another invasive procedure. Noel has the results.
Oh, hey Laura, it's Noel.
Hi, Noel.
So it is what we thought it was, which is a bulging disc in the lower back. And that's causing compression of the nerves going down the backs of his legs.
Right.
It's not mild, it's not severe, it's moderate, I would say. So that pushes him toward the likelihood of having surgery, but I would try epidural steroids first, would be my advice.
Okay, are you going to inject him now then?
Literally now, yeah, under the same anesthetic. If that's fine with you.
Yes, please.
See you both later. Bye now, bye-bye. Alrighty. Here we go. I'm just going to inject some normal saline into the hub of the needle here. And if I'm in the right spot, you can see that the fluid gets sucked down the needle, like so.
Now he can inject the steroid into the epidural space around the spinal nerves.
Okay, wake up. Thanks.
Lara and Ian are back with their daughter Evie to pick him up.
Can't wait to see him.
Okay, Buster, please. Hi, guys. When we look at the CT scan of the ankle, it looks like the implant has held up, although the inevitable progression of osteoarthritis has occurred. That's the implant there.
Okay.
And it's still there.
So you must be thrilled.
I'm
then.
pleased with that.
Yeah.
Yeah, that's as good as we could have hoped, because we got, you know, you've grown up quite a lot in those years, and this has stood the test of that time. That's the disc.
Yeah.
A normal disc is like a jammed donut. They have a fibrous outer ring and they got a pulpy inner center. So that's a normal-ish donut. That's normal, 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 and so on. This one's certainly not normal. It's black.
Yeah.
So inside the scanner, we put him in the position as if he was jumping. Okay?
Okay.
So you can see that the top of the sacrum comes down, the disc goes up, and it pinches the nerves.
Yeah.
What we've done today is we've opened up this space and injected some steroid into it here.
Okay.
We normally do 3 injections. The first one today, the second one in 2 weeks, the third one in 5 weeks from now. But it'll only help ease the pain, that's it.
Okay, and so the only way to solve the problem is, long term, is to operate. Yeah. Please God, we don't get to that point.
Yep.
Oh, Buster!
He's carrying a little bit of podge as well.
Okay.
Because he hasn't exercised enough. So he's about 4 or 5 kilos overweight by comparison to what I'd like him to be. A bit of podge going on.
Okay.
I'm just saying.
we have banned the gravy bones.
Yeah, just saying.
Looks like Buster and I could be on the same diet.
Yeah,
then.
I know.
Same pills, same diet.
I'm not going to make any comment. I'm staying well out of that. All right, grab a seat for a second. I will go and get him for you.
Oh, lovely kisses.
I suffer from back pain, so I kind of know exactly what he must be suffering. Yeah, I do really sympathise with him.
All right, mate.
Here he
is.
Boy.
Hello, darling.
Right, I will see you soon.
See you
All right,
soon.
guys, 2 weeks, 5 weeks. Take care. God bless.
Fantastic.
Bye-bye.
Thank you.
Thankfully, Buster has managed to avoid surgery for now. He will continue a course of 3 steroid injections in the hope it will alleviate his pain. Unlike Buster, 8-year-old therapy dog Scrumpy's spinal condition is at a more advanced stage. He's been prepped for surgery.
Poor Scrumpy. He's just got so many things wrong with him. And he brings so much joy and love to the world. It's such a shame. So he's cheering up other people while he's in a lot of pain himself. So no pressure. Much.
Today, Noel will be replacing the collapsed disc in Scrumpy's spine with a metal spacer, releasing the pressure on the nerves that are causing pain and making it hard for him to walk. Once the spacer pushes the vertebrae apart, Noel needs to stabilize the vertebra in front and the sacrum behind the spacer with screws, clamps and rods to hold them in position. But as with any spinal surgery, there are risks of potential life-changing nerve damage.
Sadly, Scrumpy's affected by a really severe disc problem. So the disc has dried out and bulged really badly into the base of the canal here. The nerves could get damaged. So those nerves are stuck to the roof as well as to the disc underneath. The disc underneath is down here. Man, this is just a congealed mess of fibrous scar. I think this is in the textbook of neurology under F for freaking mess. We've now got a big hole in here where we've scooped down in between the 2 discs. What I'm going to try and do is I'm going to try and put a spacer in here. It's going to be tough because the nerves all have to be pulled over to one side, and also it's bleeding like crazy, as you can see. So this is the most difficult part of the surgery and the most risky part. And you only have one shot, as Eminem once said.
Noel needs to be very careful moving the nerves to avoid the risk of permanent damage which could lead to incontinence or possible paralysis.
We're getting a lot of blood loss here. Concentrate, guys, concentrate.
With the nerves finally moved to the sides, Noel drives the metal spacer between the 2 vertebrae.
Okay, so I think I've got the spacer in now. You can see it's a real difficult drive to get it in between those nerves. Lots of blood. And then you can see the spacer right down in there.
Noel puts a small screw through the spacer so it stays in place, and then he uses large screws, clamps and rods to stabilize the vertebrae on either side.
Okay, so we got the clamps in now. You can see that the rod here gets pulled right down on top of the vertebra, and that stops anything moving. Whew, that was a toughie.
Before Scrumpy is taken to recovery, Noel is harvesting some fat as he wants to use a cutting-edge treatment to try and ease Scrumpy's debilitating elbow arthritis.
There's plenty of fat here. We're going to take some of it and we're going to send it off to the lab, from which we're going to extract some potentially anti-inflammatory stem cells that we can put in the elbows to try and calm down the pain. Plenty of potential for harvesting cells there. So that was very, very challenging. Scrumpy certainly keeps me on my toes. All right, Scrumpy. Just rock and roll.
It will be an anxious wait to see if the procedure has had any adverse effect on the nerves controlling Scrumpy's bladder and back legs.
Hello, June, it's Noel.
Hello.
It was a tough surgery, but we didn't expect it to be anything less.
No.
We had to stretch the nerves quite a lot to get all of the material out and get the spacer in. I don't know whether they'll recover or not.
Yes, right.
So we just need to be patient.
Yep.
Okay?
Thank you so much.
All right, take care.
Thank you.
Bye.
Bye-bye.
Bye.
Emergency admission Ralph is still very unwell with a serious but unknown brain condition. He's being monitored around the clock in case he has further seizures. Senior neurologist Colin Driver has come to discuss Ralph's brain fluid test results with Noel.
So are we any closer to knowing what the stuff is with the fluid?
It's quite likely to be an infection. I would imagine you've got clumps of bacteria that have arrived in the bloodstream and that have set up an infection in the brain.
So he had spinal pain,
Yeah.
but in fact, it was just the area of the brain that perceives spinal pain that's being stimulated by this stuff in the midbrain.
Yeah, we call it central pain syndrome.
I mean, what are the chances of that? Less than 10%, I would have guessed.
Yeah, absolutely. It's really unusual. I mean, I wouldn't say that I'd seen an MRI that was exactly like this, possibly ever.
Well, I can tell you categorically, I've never seen it ever.
With infection being the likely cause of Ralph's problems, Noel and Colin's plan is to treat it with antibiotics.
We do not think the cause is a direct trauma. The fluid sample has narrowed it down to probable infection or inflammation.
Have you any inkling of how this would have happened?
I mean, ultimately, it's one of those things, really. You can get bacteria into your bloodstream from cleaning your teeth. You know, it's quite possible that infections can just happen sporadically. And unfortunately, it's unlikely that we're going to find an explanation as to why it did.
The team hopes the antibiotics will bring the probable infection in Ralph's brain under control. For now, his life hangs in the balance.
Come on, mate. Good boy. Come on, boy.
It's now been a week since Scrumpy's spinal surgery. He's up and walking, but he's yet to have a pee without a catheter, and Noel is concerned that the nerves to his bladder have not yet recovered.
Come on, mate. Come on. Come on, we gotta go. So I've been waiting for Scrumpy to piddle for a few days now. His legs are getting stronger all the time, but his bladder's quite slow to recover. Come on, mate. Pee time. He's also very fussy where he wants to pee. Oh, yeah, baby. Oh, yeah, Mama, you do that. Good boy. Oh, yeah. Oh, I'm so proud of you. Oh, that's fantastic. Oh, a nice big piddle. Fantastic. That's really encouraging. So he's definitely cocking his leg and he's definitely peeing. I've never been more happy to see some pee, buddy. Never been more happy. You're such a good boy.
Now that Scrumpy has had his first post-op pee, June and husband Paul can finally take him home.
We're sort of looking forward to getting him back again at home and looking after him, and hopefully he's going to make a full recovery. That's the plan.
Right, June. And your husband.
Yeah, he does.
You actually exist. I thought she was pretending. But she actually has a minder. That's brilliant. It's so good to see you, sir. Please come in. So, he walked pretty quickly within a couple of days, and that was good news, but he couldn't pee. And I knew that that was because these nerves have been traumatized by the original injury plus the surgery.
Yeah.
And They are recovering. So just keep an eye on that. He's very fussy about where he pees. He likes to get exactly the right spot.
In the bushes.
That's right. Yeah, usually under a bush. So he drags me towards anything that can cover his modesty. So I'm delighted to say that I think he's on the mend now.
Terrific.
Thanks for coming in today. So good to see. So good to see you. You actually exist. You actually exist. Wonderful.
Thanks for your help.
See you outside. I'm gonna go get him.
Okay.
Come on, mate. This way. Good boy. Come on, buddy. Come on, buddy. Now.
Oh, my boy.
There we go.
Hello, my boy.
There we go.
Oh, yes, it's good to have Scrumpy back.
Yeah, we're looking forward to getting him back.
We've got a couple of months of physio to go through.
It's doing a real slow process.
Yes, But you're a fighter, you'll get there, won't you? Yes.
Hey.
You good boy.
Dachshund Ralph has spent the past 2 weeks at Fitzpatrick's suffering from a mystery brain condition. An infection has now been identified as the culprit, which caused central pain syndrome in his brain. Treatment is working well, and he's making a miraculous recovery.
We're here today to pick up Ralph. We're very excited. And the poor chap, all along it was in his brain and apparently was in a part of his brain which deals with pain. So he was feeling pain all over, and that's desperate. He's just 15 months old, and that shows that he's a fighter.
Now, Ralphie's mum and dad, please. You look splendid today, sir. I love the cravat.
It's not a cravat, it's a scarf.
I don't know what it is, but it's great. Right, good morning. Okay, a long journey we've had. What Colin and I and the rest of the team are looking for is a resolution of this. And what that is, we're convinced now, is edema, pus associated with infection in the midbrain. He may still have some structural abnormality in his brain in the longer term, but we're confident that we're treating it.
So I know, obviously, you didn't know him before we brought him in, so before he was in that state, but from your observation...
Oh, he's fine, you'll see any minute. You will see a dog right now that you will recognise.
But until the infection is under control, Ralph's symptoms will continue to be managed at home with medication.
As you can see, he's fine. So I've done my best for you. Okay? All right. Right, guys, look after yourself.
Thank you very, very much. Thank you.
Sir, you inspire me. If I could look half as elegant as you, I'd be doing all right. All right, I'll send Hannah down. God bless.
Okay,
bye.
He's a good boy. He seems good. He's lost a little bit of weight, and I think he's a bit frightened that we're going to leave him again because he's a bit agitated.
He was never the sharpest knife in the box, so it might be difficult to tell if he's got some brain injury ongoing, but so far so good. He looks fine.
Therapy dog Scrumpy has been recovering at home from the major surgery on his spine.
Yes, a big one.
Today he's back for treatment which will hopefully help relieve the pain in his elbows.
So in here we've got 5 ml of the biological cocktail, which comprises the fat-derived stem cells, which are potentially anti-inflammatory. We're injecting a very specific cocktail of 2 very special ingredients into Scrumpy's joints. Okay, let the battle begin. The first ingredient are specialized stem cells called pericytes, which are extracted from the little blood vessels within fat, concentrated in a specific number to have the maximum anti-inflammatory effect. The elbows are particularly bad. Scrumpy has horrendous elbow arthritis. The second ingredient are platelets from the blood, which have within them granules which also release anti-inflammatory molecules. What our team have done over the last several years is to try and make the process of treating osteoarthritis with stem cells and platelets very scientifically evidence-based. The mixture only treats inflammation and pain. It does not regenerate tissue, and it does not cure arthritis. All right. Well done, Scrumpy. Good boy. I've done my best. Now, where's my mummy?
Oh, Scrumpy.
There's my mummy.
Come on then.
There she is. Now, I'm feeling a bit stiff, Mum, because I've had both of my elbows and my hip all injected, all of them. I'm hoping this will last maybe 6 months, maybe longer. We'll see.
Yeah.
His cells are banked, so we can thaw them out again if we need to.
Okay.
Okay?
Hey, clever boy.
All right, big fella. Take care.
Thank you very much.
Careful, sir.
Thank you. Where are you off to? Come here. Oh, you come here. He's heading for the door. He can move fast when he wants to. Come here. He's going home.
For the past 4 months, Dachshund Ralph has been treated for his brain infection at home in East Sussex.
He's hugely better. He's not 100%. I think that's fair, but as you can see, he's a lot happier now.
Unfortunately, there has been some permanent brain damage, so he will never fully recover.
He's on a course of antibiotics and on a course of tablets to stop him having seizures. We're just hopeful, and to be honest, when we left him on that first time, the state he was in, I didn't think I'd see him again. So, to be honest, every day we have him back is a blessing, so it's really nice.
Buster has now had a course of 3 steroid injections, and it seems he's no longer suffering from his old back pain.
Prior to the injections, he was a creaking chair. He was in a lot of pain and he couldn't put his left foot down on the floor. You know, he's not experiencing any of that anymore, so that's brilliant. He's just a lot more nimble and moving around without discomfort.
Buster may still need further treatment in the future.
This way. He's 7.5 years old now, so we are going to do everything we can to not go the invasive surgical route. Definitely back to his old self. I mean, he is markedly pain-free now. You know, he's happy as Larry. Aren't you, Buster? Yeah.
Clumber Spaniel Scrumpy is back. He's been having regular rehabilitation to help him recover after his spinal surgery.
Good boy. This one. Well done.
Today, June's here to find out if his 7th operation has been a success.
Scrumpy hopefully is going to have his sign-off today. He still walks a bit odd, a bit like John Wayne. But he's not dragging his feet. He's not in pain, so it does look as though he's improving.
Noel has sent Scrumpy for a final CT scan, and the results are in.
Now, Scrumpy's mum. Well, you'll be pleased to hear it's good news all round.
Oh, wonderful.
Thank you. So, this looks very nice indeed. I designed this device so that the bone would physically grow through it into the other vertebrae, which is exactly what's happening.
Wow.
So, I'm happy. Okay? Don't cry. It's all good.
Oh, thank you so much.
It's all good. Hey, it's all good. It's all good, isn't it? It's all good. It's all good. Huh?
I just keep thinking what I've put me through.
Yeah, well, you've done the right thing. You're out of pain.
Yes.
Well, you're giving him a new lease of life, really.
Mm-hmm. The operation was a success, whereas I think Roll had her doubts about what was going to happen because he's had so much done.
Good boy.
He's not in pain. He's not had any painkillers since his surgery, and the stem cells have obviously helped. I think we could all do with a dose of stem cells, couldn't we? I did do the right thing. He's got through it, and we hope he's not got to do it ever again. Sorry.
Two months later, and Scrumpy is finally fit enough to resume his duties and visit some old friends.
Where are we going? You're going to see all your friends? He's walking very well. He's not in pain. He's happy enough. He's very alert. So he really has come on very, very well. Right, look, Scrump, good boy. Look, there we are. There we are. We're back.
June, he looks so well.
Doesn't he?
And his new coat's growing well, isn't it? You look lovely and fluffy and clean like a new baby. You do. Oh, it's lovely. It's lovely to see him back and looking well, considering it was a big operation, wasn't it, June?
Yes, yes.
Yeah.
Oh, you like it?
Oh,
yes.
And you like to eat.
It's nice to see him back in action. It's been a long time watching him trying to recover.
At one point, we never thought we'd see this day, but thankfully, he's bounced back, I think, quicker than I have, hasn't he?
Oh, that's lovely.
It's not just the older generation that Scrumpy is having a positive effect on.
So the question is, does the veterinary profession have the right to withhold choice?
He's been helping Noel to educate the next generation of supervets at the University of Surrey about veterinary ethics.
How far is too far? What if you have a dog that not only needs knee surgery, not only needs both elbows operated on a few times, but also has a severe lumbosacral degenerative stenosis? Shall we put that dog to sleep? And this is a really important moral dilemma now for you, because the future is yours, it's not mine. I want you to look June in the face and tell her that nothing can be done. This is real life, because that's that dog.